Your COVID-19 questions answered. Presented by UH Hilo School of Nursing in partnership with Hawaii District Health Office and Hawaii Island Public Health Nursing Office. In this video, we will discuss important information regarding the COVID-19 vaccine rollout on the Big Island. Once you receive your first or second dose of the COVID-19 vaccine, CDC guidelines to practice social distancing and wear masks are still in effect. This is because we do not yet know whether or not vaccinated people can spread the virus to others, even if they do not get sick themselves. Please follow all local guidelines and restrictions for the safety of yourself and others. When making an appointment for your second dose, register the same way you registered for your first dose. Most people will have registered online through VANS. You can make your second appointment as soon as you receive your first shot. Please keep in mind, when you register for your second dose, make sure the vaccination site is administering the same vaccine as your first dose. This may be Pfizer or Moderna. If possible, register for the same vaccination site to prevent confusion. You may be wondering if you still need to get a COVID-19 test or quarantine when traveling. Travel restrictions change often. Please check with the Hawaii Department of Transportation and the County of Hawaii COVID-19 resource site for information. It is important to know that the vaccine will not cause you to test positive for COVID-19. Current COVID-19 vaccines do not contain live viruses and cannot make you sick with COVID-19. You may test positive for COVID-19 antibodies if you take an antibody test. The presence of antibodies shows you have developed immunity to the virus. A positive antibody test is not the same as a positive COVID-19 test. While vaccination will greatly reduce the likelihood of getting sick with COVID-19, it is not 100% effective. There is still a chance that you could become infected. If you become sick, the symptoms will generally be less severe than if you had not been vaccinated. If you need to get another vaccine for work, school, or travel, please keep in mind that you cannot receive any other vaccines 2 weeks before or after a COVID-19 vaccine dose. Because the COVID-19 vaccine requires 2 shots, you must wait a minimum of 2 weeks after your second dose before receiving any other vaccine. If you need a TB or tuberculosis test, you must wait a minimum of 4 weeks to get a TB test after getting the COVID-19 vaccine. Vaccine eligibility is determined by the Department of Health. The Department of Health has set guidelines in accordance with the CDC to get vaccines to those at the highest risk. As of February 2021, kupuna over 75, first responders, healthcare workers, and frontline workers are eligible for vaccination. You can check eligibility at hawaiicovid19.com/vaccine. If you need more information, please check out the links below, which are also linked in the description of this video. Thank you for watching, and stay safe.